Okay. Thank you. Okay. Good morning, students. Sorry. Yes. Good morning, ma. Today's class is about the chambers of the heart. So other day we were doing the each one about the heart, external features of the heart. We have done with the coverings of the heart, that is the pericardium. So continuing with the same thing, let's see the chambers. Let's go inside the each chamber of the heart and view what is there. What are the features of the each chamber of the heart? So starting with the right atrium, because we knew in the heart there are four chambers, that is right atrium, right ventricle, left atrium or left auricle, and one more is the left ventricle. So we will be seeing the each chamber. In that each chamber, let's see the first start with the right atrium of the heart. Yes, when you come across the right atrium, the main things that point out is what are the morphology, means what are the external features of the heart. When you are coming across the external features of the heart, the first thing is what is the shape, where the right atrium is actually situated, what is the extent of the right atrium, from which part to which, from where this chamber is called as right atrium. So first coming to the shape. So when you are seeing here, I think you can see here the right atrium. So this is the right atrium. So it is conical in shape. So this is part which is, it is elongated, which is extending from superior vena cava above to that of the inferior vena cava below. So in this way, when you are saying the shape, when you are saying the shape of the right atrium, it is elongated, extending from, so this chamber is elongated, extending from superior vena cava above to the inferior vena cava below. So here you will be getting the inferior vena cava. So this is superior vena cava, this is inferior. So up till that part is your right atrium. You can see the right atrium as a small extension. So this is a small extension which is going to that of the left side. So this conical expansion which is going to that of the left part is called as a ear-like expansion, which is called as auricle. So this ear-like expansion which is going from right to that of your left side at the part of that of your aorta. So this is the aorta. So which is at the infundibulum. So this is called as a auricle. So this is a small ear-like extension which is extending towards to the top of the left side. So after the shape, next coming to the situation of the right atrium. So where it is situated, as it is we said, yes, right atrium actually where it is situated, when we are saying it is in the heart only, but in the heart also, when we have done with the external features, we said the heart as the apex. So this is the apex, the base, the surfaces are present such as sternocostal surface, diaphragmatic surface, right and the left surface. Coming to the borders are, so this border is called as a right border, this is the inferior border. So the border that you are seeing on the left side is called as a left border, and this is the superior border. So in these external features, when you say what is the location of the right atrium, where it is located within the external features. So whole of the right border that you are seeing, which is extending from superior vena cava above to the inferior vena cava below. So whole this is occupied, whole of the right border is occupied by the chamber which is called as that of the right atrium. So this is a location in the heart. So when you got the heart, how to locate the right atrium? So you have to go to that of the right border first and see where is superior vena cava. So when you extend from superior vena cava to the inferior vena cava, you get to see that of the chamber of the heart which is called as that of the right atrium. So this is the right atrium which is present on the part of sternocostal surface of the heart. I think by now you knew it. What is sternocostal surface? So when we are doing the external features, this was also said that the surfaces of the heart are sternocostal surface, diaphragmatic surface, right and left pulmonary surfaces. So on the sternocostal surface, you will get to see that of the chamber that is called as right atrium. So this is the situation. Now coming to the extent of right atrium. Yes, as it is we say it extends from superior vena cava above to inferior vena cava. But coming to the surface landmark, from way to way this chamber is extending. So the right atrium is extending from costal cartilage, that is third costal on the right side, because this is on the right border. So this is part what you are seeing is the right border. So it is extending from the third costal cartilage to that of the sixth. So on the right side, upper right third costal cartilage to the lower right sixth costal cartilage, the extension of the right atrium you can notice. So this is the right atrium where you can get it, the right chamber of the heart. So this is the extension. It extends from third costal cartilage to that of the sixth costal cartilage on that of the right side. So this is the extension of the right atrium. So when you have seen the right atrium, we have gone through that of the shape, situation and extent. So whenever you are seeing the shape of the right atrium is elongated, extending from superior vena cava to inferior vena cava below. So that is the shape. Now coming to situation, yes, the right atrium is situated on the right border of that of the heart. So this is the right border of the heart. So on the right border, on the surface, that is the surface is on a part of sternocostal surface, because whole this surface is called as sternocostal surface. In that, 1/3 of the sternocostal surface is occupied by means of that of the right atrium. When you say the extent of the right atrium, from where to where its extent is, on the right border, it is extending from right third costal cartilage to the right sixth costal cartilage. The right atrium is extended. After this, what are that of the external features? So when you are going to externally, when you are seeing this chamber, so this is the chamber that we are discussing now at such. So this is the right atrium. So externally, what are the things? As such, we have said the small ear-like elongation, what you are seeing for the right atrium. So this is called as right auricle. So this is the right auricle because it is ear, so that is called as auricle. So when you see that auricle, it is not smooth, it is having notches, so it prevents the free flow of the blood. So free flow of the blood doesn't flow very freely because of these notches which is present on that of the auricle. The next external feature here is sulcus terminalis. So the right atrium is separated from that of the other part by means of a sulcus externally from superior. So we say the right atrium is extending from superior vena cava above to inferior vena cava below. So here on the right side, on the right border, there is a groove which is extending from superior vena cava to the inferior vena cava. That groove is called as sulcus terminalis. So this would be the groove. So this is the sulcus terminalis. When you cut open, so when you have to open the right atrium, because next we will go inside the right atrium and see. So when you cut open, so where at that which part we will be cutting is at the part of the sulcus terminalis. We will give a nick at that part, means we will give a cut at that part and open. So this is called as a sulcus terminalis, which is extending from superior vena cava to that of the inferior vena cava. Next, there is a groove which is present, which is called as, actually when we are discussing about the external features also, there also we have discussed about the groove. This is called as right atrioventricular groove. Means this is the atria, this is the ventricle. So this is right atrium, this is the right ventricle. Between the right atria and the right ventricle, there is a groove what you can see, which is called as right atrioventricular groove, through which you can see an artery which is passing, which is called as right coronary artery, which is supplying to that of the heart. So this is the right coronary artery and this is the right atrioventricular groove, where you can come across a right coronary artery with a vein which is called as small cardiac vein. So externally, the features of the right atrium, what you can see externally, when you are seeing the right atrium from outside, you have not opened, you have seen this chamber only externally. So when you are seeing only externally, what you can see is a sulcus, you can see it, which is called as a sulcus terminalis. This is a sulcus terminalis, which is so this is the back view. What you are seeing, this is a back and this is a front view. So in the back, what you can see is a sulcus. So this is called a sulcus terminalis, which is extending from superior vena cava above to inferior vena cava below. This is the first feature. Now, other than that, what other features that you can see externally is, you can see this atrium is having a small extension towards to the left side. So this is the right side and this is the left side. So small extension, ear-like extension which is going on the left side. So this is called as auricle. So when you are seeing this auricle, as such it is not smooth. It is having a notched feature. Notches means it is irregular, having a notch. So that notches is preventing the free flow of that of the blood. One more thing is atrioventricular groove. Between the atria and the ventricle, there is a groove which is present, which is called as right. On the right side it is present, so it is called as right atrioventricular groove, through which the right coronary artery, along with it you can see the vein which is called as small cardiac vein, passes through the atrioventricular groove. So this is about the external features of the right atrium. Sulcus terminalis, march, that is the margins which are notched, which is called as auricle, ear-like extension. The groove which is present between the atria and the ventricle, which is called as atrioventricular groove. Now, so when you see the right atrium externally, what are the relations? Means what you can see the right atrium in front, behind, laterally and medially. What are the things that you can see? So as such, now you can understand this is the right atrium. So in front of the right atrium, what you can come across is that of the sternum with that of the ribs. So if you have seen, so here you will be getting the right atrium. So you can get that of the sternum with that of the costal cartilages are the ribs. So in front the relations are the sternum with that of the costal cartilages. So these are the relations that you come across in front. When you go behind, to the right and the left side. So when you go behind, so in front you get to see that of the sternum with that of the ribs, costal cartilage. So behind you can get to the see that of the lungs, because either side the lungs are present and the long tubes that are such as trachea and esophagus will be. So you will be seeing that of the lungs on that of the either side. Next, coming to that of the relations medially and that of the laterally. When we are seeing to that of your medially and laterally, what you will be coming, it is related to the mediastinal surface of the lung. So medially it is related to the mediastinal surface of the right lung. Laterally it is to that of the left lung. So this is what you are seeing is the mediastinal surface of the right, and at this part is that of the trunk, that is the pulmonary trunk, which comes to that of the left side along with the left lung, but it is a pulmonary trunk module. So these are the relations of the right atrium. So the relations of the right atrium, I'm repeating again. So when you are seeing the relations for front, so this is the right atrium. So here in relations the meaning is in front what you are seeing, behind, medially and laterally. In front what you will be seeing is sternum with the costal cartilages, that is 3rd to 6th rib you will be seeing in front. It is related in front to that of the 3rd to 6th costal cartilage along with sternum. Behind it is related to that of the pleura along with that of the lungs. Medially, the right atrium, it is related to the mediastinal surface of the lung. So the lung has some surfaces. So in that the surface is the medial surface. The medial surface in it, it has includes the surface which is called as mediastinal of the laterally. It is related to the pulmonary tract along with that of the left. So these are the relations of the right atrium. So this is back what we are seeing it. So this is the features, what you are the relations of that of the right atrium. So now let's see when you open inside the right atrium. So up till now what we have seen is only externally. Externally what things that you can see is that what we have discussed after. So externally what you see and what are the relations, means in front, behind, medially and laterally. So in externally what you can see is these are only the structure, that is sulcus terminalis, that is a notched ear-like extension, auricle, groove, atrioventricular groove. So these are the only things that you can see on the right atrium externally. Now when you cut open the right atrium and when you go interior of the right atrium, what features that you can see? So now you have opened the right atrium. Yes, when you open, yes, you can see this. So now the right atrium has been opened out, and when you go inside and see what things you come across. You come across some rough parts. So you can see some here. These things muscular extensions. This is the rough part of the right atrium. This part what you are seeing is a smooth part of the right atrium, and this is the intermediate part of the right atrium. So when you open the right atrium, so when you go inside the right atrium, open the right atrium, what things? So it is divided into the top your smooth posterior part. Yes, so this is the part what you are seeing is a smooth posterior part. So this part whole is a smooth posterior part of the right atrium. Next, coming to that of the rough anterior part. So when you see in front, so this is the rough anterior part. You can see some muscular ridges in between. So this is a rough anterior part. Next is that of the intermediate part between the smooth and the rough part. You can see the intermediate part. So here I think in this picture is this is the intermediate part of the right atrium. So when you open the right atrium and go inside and see what things is the smooth posterior part, rough anterior part, and the intermediate things or the intermediate part can be seen. Now when you see the developmental part as such for you it is not, but have a little note about it one. So the smooth posterior part is developing from the sinus venerum. So from the sinus venerum is a smooth posterior part is developed. When you see the rough anterior part develops from the top the primitive atrium or the atrium proper. So when you come across the intermediate, yes, septum primum, we will be going on when we are going in detail, but let us see the each part or the each parts in detail. So we are started with the top the smooth posterior part. So in this smooth posterior part, so this is a part now what we are discussing. So this is a smooth posterior part which has been developed from this, which is called as sinus venerum. This is a rough anterior part which has developed from atrium proper. So this smooth posterior part, what are the features that you see in the smooth posterior part is there will be the opening of superior vena cava. You come across the opening of inferior vena cava, opening of coronary sinus. Next is foraminae minimi means venicae minimi veins and intravenous tubercle. These are the top your valves which will be present, but all the things, all the openings, do remember in the smooth posterior part is the opening of all the veins, means opening of superior vena cava is a vein, inferior vena cava, coronary sinus and venicae minimi veins, means all the veins open into the smooth posterior part of right atrium. So let's see here the opening. So as we have said, so this is the part what you are seeing. This is a smooth posterior part. So this inside part is a smooth posterior part. You can see the opening of, we have said earlier, the smooth posterior part includes the opening of in the features, that is opening of superior vena cava. So this is superior vena cava. So this is the opening of superior vena cava guarded by the top here valve. So it is guarded in the primitive stage, it is guarded by a valve that is called opening of the superior vena cava. Next, this is what here you are seeing is the opening of the inferior vena cava which is guarded by a valve, Eustachian valve. So this is a valve what you will be getting here. So but the opening is the opening of inferior vena cava. Here is the opening of coronary sinus. The coronary sinus opens into the smooth posterior part. Other than that, what we have seen is the many veins, that is venicae minimi veins are opening. So these small things that what you are seeing is foramen venerum or minimi or venicae minimi veins which are opening into the smooth posterior part. So whole of the smooth posterior part which has developed by sinus venerum, what it includes or what it has is all the openings. Means it is the opening of superior vena cava above, inferior vena cava below. To that of the side beside the opening of inferior vena cava is the opening of coronary sinus along with many cardiac veins, that is a small cardiac veins. So when we have discussed this external features, means what are the features, what does the smooth posterior part includes, we have seen. I think in that of your slide, I think you have gone through that of your, I have shown the opening of superior, opening of inferior vena cava, opening of coronary sinus, many cardiac veins are foramen venerum. So these are the things. So this is the what your smooth posterior part of the right atrium has. So it has all the openings. So Lima, it is a venous opening, that is the superior vena cava, inferior vena cava, coronary sinus and foramen venerum are minicardiac minimi veins. All these veins open into the smooth posterior part of right atrium. Yes. So after the smooth posterior part, let's see that of your rough anterior part. So what is the rough anterior part? So we have said the right atrium is divided into smooth posterior part, rough anterior part and the intermediate part. So when you see the rough anterior part, what things that you can get into the rough anterior part? First one is the crista terminalis and musculi pectini. So when you see this, so these are the, so this is a rough anterior part. So this is a rough anterior part. So which consists of, so these things what, so this is the crista terminalis. Externally, if you remember, when we were telling about the external features of the right atrium, we have said from superior vena cava to inferior vena cava, there is a sulcus which is called a sulcus terminalis. So externally, which the sulcus which is present is sulcus terminalis, which is extending from superior vena cava to inferior vena cava. Same sulcus, when you open, now the right atrium has been opened. When it was closed, we said that it has a sulcus terminalis. But when you open it, now that at that part you can see this part, this is called as crista terminalis. So inside it is called as a crista terminalis. From the crista terminalis, you can see small tooth-like extensions like a comb. There are the extensions which are extending downward below to that of the, which is extending from superior vena cava to that of the coronary sinus below. So these are called as musculi pectini. So these are the small muscular ridges. Because of this ridges only, this part of the right atrium is called as rough. Because the the anterior part of the right atrium is rough. The anterior part of the right atrium is rough because of the presence of these feature which is called as musculi pectini. So because of these muscular ridges, the anterior part of the right atrium is rough. So these are the features of the rough anterior part. So rough anterior part only consists of two features. One is the crista terminalis, one are that of the musculi pectini. So this is the crista terminalis. Same feature when you go in externally, it is called as sulcus terminalis. From the crista you can see some horizontally extending muscular ridges which are called as musculi, or tooth comb like structures which are extending, which are called as musculi pectini. Because of this part, it is called as rough anterior part. Now coming to the intermediate part. So we have done with the smooth posterior part, rough anterior part, and what is now in the intermediate part. So in the intermediate part of the right atrium, when you open, what is the things what you can see? So the features in the intermediate part is, first is fossa ovalis, limbus fossa ovalis, triangle of Koch and torus aorticus. So when you see first one is, this one is that of the fossa ovalis. In the primitive stage, the right atrium is opening into the left atrium by a valve here, which is called as that of here. It is open from right to that of the left side. There is a valve or the opening which is present, which is called as that of the fossa ovalis. So in the intermediate part, what you can see is fossa ovalis. But after the birth, gradually this fossa ovalis is closed. It will be closed. So if there is, you say that is patent ductus, but if it is, then normally it will be closed. So it is called as that of the fossa ovalis. So in the intermediate part, a cup-like depression. So a cup-like depression which is seen. So this cup-like depression is a depression which is normally open in that of your, when you are seeing the embryological part, where right atrium is sending into the of your left atrium. So right atrium to the left atrium, the blood sends because of this fossa which is called as fossa ovalis. But after birth it is closed. This will be closed. Surrounding the fossa ovalis there is limbus which is called as limbus fossa ovalis. So this is the surrounding to that of your fossa ovalis. You can see the limbus means the extension which is called as a limbus fossa ovalis. So this is the limbus fossa ovalis that you are seeing it. Other than that, the intermediate part, the other features are triangle of Koch. So what is this triangle of Koch? So this is where you are seeing in the intermediate part, this triangle, it is called as the triangle of Koch, which is bounded by, to the right side it is a tricuspid valve. So this is what you are seeing. It is a tricuspid leaflet or the tricuspid valve at the top here towards the base, and to the top of the apex part it is a coronary sinus that you are seeing. So this is a coronary sinus. So within this, so one, now you can see this triangle. So this is a triangle. What it is happening? So this is a base which is formed by that of your tricuspid leaflet. So this is a tricuspid leaflet. The other side it is formed by that of your coronary sinus guarded by a valve which is called as a eustachian valve. At the upper part there is a tendon which is called as tendon of Todaro, or the fibers which are present. This is called as tendon of Todaro. For you it is not so important, but this is a triangle of Koch which is present in the intermediate part of the right atrium. So what is present in the intermediate part? So when you are seeing here, so the apex of the triangle is marked by the central fibrous body which is called as that of your atrioventricular conduction bundle, what it is going on. So this is the apex of this triangle. So this triangle is that of your apex, what you are seeing here, and it is forming, what it is forming is a triangle of that of the Koch. So this is a triangle of Koch which is present, and the importance of the triangle of Koch. What is present in the triangle of Koch is a AV node, which is one of the pacemaker of the heart. So there are some pacemakers such as SA node, AV node, Purkinje fiber. So these, in this, the triangle of Koch includes the AV node. So what it has is a AV node is situated in the triangle of the Koch. So this is the importance of the triangle of Koch. After that, we have said as a feature as torus aorticus. So in this you have seen the torus aorticus. So what is torus aorticus? In the intermediate part of the right atrium. So this is what you are seeing, a small elevation. So this is a small elevation. What this elevation is called as that of the torus aorticus. So this is the elevation that you are seeing at that of the aortic sinus. The right aortic sinus, at the right aortic sinus, you are seeing the small elevation which is present. So this is called as that of the torus aorticus. So this is the elevation that you are seeing. So this is torus aorticus, what you have come across. Yes. As such, when I was saying, I would tell the developmental part, a part of that of your development. So when I was saying that smooth part is developed from that of your sinus minorum, the rough part is developed from sinus minorum, smooth part is from the primitive atrium. So when you are seeing here, so this is part, this is the primitive atrium that we are seeing it. This is the primitive atrium. So this is what we are seeing is a septum primum. This is a septum primum. So when you are seeing it, so the muscular part of the right atrium is formed by the primitive atrium. The muscular part or that of your the part is formed by that of your primitive atrium. That is, a rough part is formed from the primitive atrium, whereas the smooth part, as such we have discussed, is the sinus venosus. So if you see what is sinus venosus, yes, so wait, yes, so this part what you are seeing is a sinus venosus. So this is a developmental part. Actually the heart is developed from two tubes. When the two tubes, though you can see four bulbs which are called as, so first one is called as truncus aorticus, bulbus cordus, primitive ventricle, primitive atrium and sinus venosus. So the right atrium is formed, the rough part is formed by sinus venosus, this is the sinus venosus, and the smooth part is formed by the primitive atrium. So these two parts is developed from, so these two parts gives to the development of the right atrium. So right atrium has developed from these two parts. So gradually when you are seeing is, so this is the sinus venosus. So from this, from the upper part, what you are seeing here is the cardiac vein, what it is forming here. So right horn forms a smooth posterior part of your right atrium. So when you are seeing, so this is that of your horn. So this is the right horn, this is the right horn, and this is the left horn. So the right horn of the sinus venosus, this is the right horn of the sinus venosus, which gradually develops as a smooth posterior part. Next, right common cardial vein. So what you are seeing as such, this is a right common cardinal vein. This is a right common cardinal. Gradually it develops into the top, the lower part of the superior vena cava. So the lower part of the superior vena cava is developed from the right common cardinal vein. So this is a right common cardinal vein which develops into the top, the superior vena cava later. Next, the right midline vein which forms the opening of the inferior vena cava. So this is what is that of the midline vein. So the right midline vein which forms the development. This is the superior vena cava which has come. So this is what it is getting, the superior vein. So this midline vein develops into that of the inferior vena cava. The left horn, the diminished body at the left horn forms that of the coronary sinus of the left horn. So we have seen the right horn. Up till now we have seen the right horn developing into above superior vena cava. But we know the midline vein gives rise to inferior vena cava. Whereas the left horn, what we are seeing, it develops into that of the coronary sinus. So this is the part for you. It's not so important, but only a mark of the development, how the right atrium and the primitive atrium has developed from sinus venosus and that of the primitive atrium. Yes. Yes, so along with that, so what we have said is, I have summarized the development here. So the muscular part of the right atrium, that is the rough part of the right atrium, is developed from the primitive atrium. The smooth part of the right is developed from that of your sinus venosus. The fossa ovalis has developed from that of the part of the septum primum. So this is part is that of your septum primum. This is septum intermediate. Normally it will be closing. If it is just called as the foramen or called as the foramen ovale. So this is the foramen. The part of the septum primum is developing as fossa ovalis. The annulus surrounding the ovalis, what it is present, it is developed from the septum secundum. Crista terminalis, the cranial part is part of crista terminalis, is developed from a valve which is called as sinoatrial valve. The valves of inferior vena cava and coronary sinus, both valves of inferior vena cava is developed from that of the right sinoatrial valve. This is a cranial part of right sinoatrial valve develops crista terminalis, whereas a caudal part of sinoatrial valve develops inferior vena cava and coronary sinus. Interatrial septum is formed by the fusion of septum primum and septum secundum along with the topier part of sinoatrial valve. Coronary sinus is developed from the left horn of sinus venosus. But actually this is the development, but for you it is not so important. The important things of the what you can see is, what you have to tell is only the external features and that of their internal features of the right atrium. So when you are seeing the right atrium, the first thing, so I am again repeating the same part here. So when you are saying it, the main things is that of the features, shape, situation and the extent. So when you are saying it is elongated, extending from superior vena cava to the inferior vena cava below. When you are saying the situation, it is along the right border and it is formed by a part of 1/3 of the right atrium is formed by a part of the surface which is called as a sternocostal surface. It forms a part of that of your right atrium. When you see the extension of the right atrium, it extends from the 3rd costal cartilage to that of the lower right 6th costal cartilage. So this is the important thing. Now coming to the only the external features. When we are seeing the external features only outside, what things that you come across in the right atrium? One is sulcus terminalis, One more is a right auricle. The other thing is a right atrioventricular groove. So this is a sulcus terminalis which is extending outside. So now you knew what is crista terminalis also. So when you cut open this from the superior vena cava to inferior vena cava along the sulcus terminalis. That time what the margin that you are getting inside, that is called as crista terminalis. So this is a sulcus terminalis what you can see. Now one more thing in this picture, you can see a small ear-like extension. That ear-like extension is called as that of your auricle. Between the atria and the ventricle, you can come across a groove which is called as a atrioventricular groove. What passes through this atrioventricular groove is right coronary artery with a vein which is called as small cardiac vein passes. Now, coming to the relations, what are the relations of the right atrium? So, when you get it, what in front, behind, laterally and medially, what are the relations? So, in front of the right atrium, what you get to see is, you can see the sternum along with that of their costal cartilage, that is third to that of their sixth costal cartilage. When you go behind and see, what is the things that you can see is that of the lungs, that is a pleura, covered with that of the lungs, covering that of the lungs. On either side, means on medially and laterally, you can come across a medial sternal surface of the right lung. On laterally, it is a pulmonary trunk. So these are the relations of the right atrium. Now coming to the interior of the right atrium, when you cut open and see what things that you can see inside that of the right atrium. So you can come across three parts, that is a smooth posterior part which has been developed from sinus minerum, the rough anterior part which is the atrium proper, and the intermediate part. So these are the three things that you see when you open the interior of the right atrium. So when you see the interior of the right atrium, so the first part is a smooth posterior part. So this is a smooth posterior part of the right atrium. This is the rough which has been developed from sinus minerum. This is the rough anterior part which has developed from the atrium proper. This is the intermediate part what you are seeing. So this is the intermediate part. So when you see the features of each part. So next what we have done is we have done with each part, smooth, rough and the intermediate part. Let's start with the smooth posterior part which has been developed from sinus minerum. So in the smooth posterior part, what are the things that you can see in the smooth part is you can come across the opening of superior vena cava, opening of inferior vena cava, opening of coronary sinus, some venae cavae minimi veins, and the valves, that is the eustachian and intervenous tubercle or tubercle of lower also you can call as. These are the valves which are present in superior and the inferior vena cava. One is present in superior vena cava, that is intervenous tubercle of lower, and the inferior vena cava, that is a eustachian valve which is present. Yes, but these are the valves. But the most important thing in the smooth is all the openings, opening of superior, opening of inferior, opening of the coronary sinus, and the foramen minerum minimi veins. So when you see it in the diagram, so when we are showing that this is whole is a smooth part. So this whole is a smooth part. This is a rough part. So the smooth part of the right atrium has an opening of superior vena cava above. Next, which is guarded by a valve. This is guarded by a valve or valve of lower at the early stage. Next, at the lower part, you can see the opening of inferior vena cava, which is guarded by a valve which is called as eustachian valve. Next, beside this one, you can see one more opening which is called as opening of coronary sinus. This is the opening of coronary sinus guarded by its own valve. That is, this is the opening of the coronary sinus. Above you can see small openings, many small openings which are called as venae cavae minimi veins. So these are all which are present in the smooth posterior part. The posterior part is smooth, it has only the openings. Do remember that it has only the openings of all the veins opening into, because when you remember right atrium, deoxygenated blood comes. From where the deoxygenated blood comes? Yes, it has to get its deoxygenated blood either from above, from superior vena cava, whole of the lower part of the body from the inferior vena cava, whole of the heart from that of your venae cavae minimi, and through that of the opening of the coronary sinus. So in this way, all the openings are present in the smooth posterior part which has been developed from sinus minerum. Yes. Now, I'm not going deep into the developmental part. But for you, it is not so important. Just I am giving a gist of that one, because here and there in your books also it has been the names are there, but it has not been told very extensively. But so that only I am giving the names also, from where how these are coming. It is embryological developmental parts. Next, coming to that of the rough anterior part. So the rough anterior part, what features that you come across in the rough part? What are the things that is present? In the rough part, what things that you can see is, one is crista terminalis, one more is musculi pectinata. These are the muscle which is present. So when you are seeing it, so this is a rough part, rough anterior part. So which includes, this is a crista terminalis. If you remember, when we have studied the external feature also, there we have said one sulcus which is called as sulcus terminalis. So when you open it inside, this is called as that of the crista terminalis. So this is a crista terminalis which is present in the rough anterior part. From the crista terminalis, a comb-like structures are the tooth comb. On the comb, what that you comb the hair, you can get to see some extension. So that comb-like structures which are extending from the crista terminalis is called as musculi pectinata. So these are the muscular ridges which you can see, because of which this part is called as the rough part. So this is a rough anterior part of the right atrium. Okay, only these are the things that you can see in the rough anterior part. Let's see the intermediate part, what it is present. In the intermediate part, you can see that of the fossa ovalis. So this is a fossa ovalis which is a remnant at the earlier stages. At the embryological part, the right atrium is opening into the left by means of this fossa only. But gradually after the birth, it closes. Normally it closes. So this is called as a fossa, a cup-like depression which is present in the intermediate part of the right atrium is called as fossa ovalis. So this is fossa ovalis. Surrounding it, yes, this is surrounding part is called as a limbus. Surrounding it is called as limbus fossa ovalis. So this part is called as a limbus fossa ovalis. Other than that, the other features that you can see is, one is triangle of Koch, and one more is of that of here a dilatation which is present. So what is a triangle of Koch? So this is a triangle of Koch which is bounded by tricuspid valve, coronary sinus and tendon of Tadaro above. So within this it forms a triangle which is called as that of the triangle of Koch. The importance of this triangle of Koch is AB node is situated in the triangle of Koch. So AB node, that is one of the pacemaker, atrioventricular node is present. It is situated in the triangle of Koch. Yes, that is important. One more thing, a small dilatation that we have discussed, which is called as torus aorticus. So this is a small dilatation which is present at the top, the intermediate part of the right atrium. This dilatation is called as the torus aorticus. Now, let's see some applied part. As such, for you, only the important things I will be getting across. The interatrial septum. Now you can understand the intermediate part. When you are seeing the intermediate part, there is a fossa which is called as fossa ovalis. So this is the intermediate. As such, earlier in normal heart, when you are seeing in the normal heart, there is no foramen of oval which is present. So this is the right atrium. This is the left atrium which is present. But here at this part, here you can see a small opening which is present. So this is called as a foramen of oval, where the blood from the right enters into the left atrium through this foramen, which is called as a foramen of oval. If it is patent, it is called as propatens of the foramen oval. So this is the first part what we are getting. There is a premature closure of the foramen oval. Normally it closes before birth, but occasionally it may not be that of the it may not be closed. Then there is called, it is normally in local language, colonial language, we call it a hole in a heart. What it is only there is a small probe or a small foramen which is extending, which is that opening is open after that of the birth also. Normally in normal heart it will be closed in this way, but in some cases it might be open, that is called as propatency or patent foramen ovale. So this is called a patent foramen ovale, which is patent from right atrium to that of the left atrium. Yes, normally as such, normally the foramen ovale should be the closure of the foramen ovale due to the prenatal life. Due to excessive development of septum secundum, it results in hypertrophy of the right side of the heart. Right side of the heart gets, it becomes enlarged and leads to death shortly. Occasionally this might happen, but it leads to death very shortly. For you it is not so important, ma. So these are the cardiac anomalies. Only the one cardiac anomaly that for you it is important is, for you it is important is interatrial, that is a patent foramen ovale. So this is a patent foramen ovale. Do only remember the intermediate septum as foramen ovale. I think by now you can understand. But actually at that of the embryological part, the right atrium to the left atrium, the blood goes. So when you see that of your fetal circulation, from right to left, the blood will be going through that of your foramen, which is called as foramen ovale. But after the birth, normally it should be closed. If it is patent, then it is called a patent foramen ovale. So this is only the clinical part of the right atrium. So this is one chamber of the heart that we have dealt. Yes, great. So continuing the class, the next is about that of the left atrium. Wait. Yes. So as such I have said, I will be doing today the right atrium. The other class will be the left atrium and other chambers of the heart, means the ventricles of the heart. So we will be seeing after the right atrium. Let's see that of the left atrium and the other and that of the other chambers, that is the right and left ventricles of the heart. So let's start with that of the, after the right atrium, let's start with that of the left atrium of the heart. Yes. I think by now it is clear. The right atrium, what things you see it externally, what things you see it internally. So externally, the only features that you came across to see is auricle, sulcus terminalis, atrioventricular groove. Externally for right atrium, I am not going to left, just I am viewing it. Other than that, internally if you are seeing it, what things you see it? There are three parts: smooth posterior, rough anterior, intermediate. Smooth, why I am telling is you can demarcate it. The smooth posterior part has the openings of superior vena cava, inferior vena cava, opening of coronary sinus, many cardiac veins along with the valves are present in the smooth posterior part. The rough anterior part includes crista terminalis with musculi pectinae, whereas the intermediate part includes fossa ovalis, foramen. Next is that of your, there is a limbus fossa ovalis surrounding the fossa ovalis. Next is the triangle of Koch and torus aorticus. So these are the features that you have come across once you got known to these features now. Now, keeping these features in our mind, let's see what the left atrium, what these chambers have. Is the features which are present in the right atrium are present in the left atrium or not? So let's see. First, coming to the general features of the left atrium. So first, coming to the situation where it is present. Left side, it is situated to the left side of the right atrium. So when you are seeing it, yes. So when you are seeing it, so this is the right atrium. So this is the right atrium. You are seeing this is the left atrium. Do remember, if you can see the picture, this is from behind. It is not from front. From the front, you can't see the left atrium very clearly. What you can see, if you can see a small ear-like extension that you have seen in the right atrium, which is called as auricle, right auricle. Same way on the left side also in front, if the view is from front, what you can see is, you can see that only the small ear like extension that you can see, that is a left auricle you can see. But to view the left atrium, very nice, and you have a better view, it is to go back of that of the heart and see that of the left atrium. So this is the left atrium. When you say the situation of the left atrium, it is present to the left of to that of the right atrium. So this is right atrium and this is the left part. So when you see the features, it is situated to the left of the right atrium. So this is the right atrium, to the left of the right atrium is the left atrium. And when you see it externally, yesterday we have said the external features. In the external features, we came across the apex of the heart, base, surfaces as stenopostal surface, diaphragmatic surface, four borders. So in these, what is a base forming? So the base, the left atrium forms the 2/3 of the base. 2/3 of the base is formed by that of the left atrium, because this is the apex, this is that of the apex, and this forms that of the base. So when you are seeing it, so yes, so this is the apex part, this is the base. So when you are seeing 2/3 part, 2/3 part of the base is only formed by, exclusively formed by means of left atrium. Only 1/3 part of the base is formed by means of that of the right atrium. So base of the heart is, of 2/3 part of the base is formed by that of the left atrium. Next, its posterior surface forms the, if you have come across the pericardium, if you do remember the class of the pericardium, there we got to know two sinuses, that are the spaces. One is a transverse sinus, one more is a Caldi sinus, which is called as an oblique sinus. Yes, the left atrium forms anterior boundary for this oblique sinus. For the oblique sinus, as it is the other day on the pericardium class, as such I have told. Oblique sinus, the situation of oblique sinus, which is a Caldi sac, it is present behind that of the left atrium. So when you say if it is present behind the left atrium, so the anti of the left atrium, that is oblique sinus, is formed by means of the left atrium. I think you do understand, the Caldi sac or the oblique sinus is present. If you do understand, it is present behind the left atrium. Behind the left atrium, the sinus is present. So the boundary for the left atrium forms anterior boundary for that of your oblique sinus. It is only the meaning is that much. It is forming the left atrium is forming the anterior boundary of oblique sinus. Next, anterior superiorly, there is a small conical projection. As such, in the right atrium also we have seen. Same way, you can see here on the right atrium also, when we are discussing the right atrium external features also, we have said the right atrium, a small elongation towards the left at that of the infundibulum, which is called as auricle. Same way, in the left atrium also, a small conical projection which is extending towards the infundibulum of the heart. So this is the infundibulum, what you are seeing it at the conical projection which is extending towards the left. It is called as the left auricle. So this extension, conical projection, this is called as infundibulum. This is the infundibulum, what you are seeing. This small conical projection which is coming towards the left side. So this is called as the left auricle. Again, ear-like extension, what you can see. So this is the left auricle, what you are getting. Yes, anterior superiorly it presents a small conical projection for left auricle. This left auricle, it overlaps the infundibulum of right ventricle. It will be overlapping the infundibulum of right ventricle. So this conical projection extends up to the top of your right ventricle. So this will be overlapping. So I think you can see here it is overlapping the infundibulum of that of your right ventricle. This is right ventricle. This part is that of the left ventricle. So this part is the right ventricle still. So this is overlapping the infundibulum of right ventricle. Yes. Now let's see the interior of the left atrium. What it has, as whether you can see the same features as right atrium, like rough, smooth and intermediate part, or any other deviation or differentiation is present. When you see the interior of the left atrium, what is present? It consists of most of the wall here is smooth. When you cut open the left atrium, unlike the right atrium, if you have seen here, when you have seen in that of the right atrium, you have seen the some part is rough, some part is smooth, and there is some intermediate part. But in the left atrium, most of the interior of the left atrium is smooth part. So most of the interior of the wall is smooth. There is no rough part as such, only a small part is present, but most of the intermediate of the left atrium is smooth. A network of musculi pectinate, same thing you can see even in the, you have seen in the right atrium also, is found within the left auricle. So the ear like, within the ear like, most it is smooth only, but these musculi pectinate which are also present in the right atrium, which is for making that part as rough. Here in the left atrium also, these musculi pectinate are also present in the left atrium, but it is present in the auricle. So that network of this muscle is present on the left auricle, not in the atrium, means whole of the left atrium is smooth. What the network or the rough part is present, it is present in the auricle. That is a main important part. One more point is the posterior wall of the left atrium. So this is the left atrium. The posterior wall of the left atrium receives all the four pulmonary veins. If you have clearly seen here the picture, when we are going on through it. So this is the left atrium. You can see the opening of. So these are all that of your veins that you are seeing. So all that of the pulmonary veins are, there are four pulmonary veins which are opening into the left atrium, which brings the oxygenated blood from the lungs again to that of the left atrium. So you, on the posterior surface of the left wall of that of your left atrium, you can see the opening of the four valves and the four pulmonary veins which are opening into that of the posterior wall of the left atrium. Next, the anterior wall is formed by interatrial septum. If you have came across in the right atrium, there is also anterior wall is there, posterior wall is there, intermediate wall is there. So in here also the anterior wall of the left atrium is formed by interatrial septum. The septal wall shows a fossa which is called as a unit, which is formed by septum secundum. This is developmental, septum primum, septum secundum. But the main clinical, the importance of the left atrium, what is the, when you have seen the differentiation between the right and the left atrium, the right atrium unlike has some smooth part, some rough part and the intermediate part. But do remember, when you go and differentiate in the left atrium most of the part is smooth. Only the rough part is present only in the left auricle. This is the main important thing that you have to understand. One more point. As what is the importance of the left atrium? Clinically, what is that? Because the left atrium receives that of the oxygenated blood. So the potential site for thrombus or the clot formation is mostly it is of that of the left atrium. Yes, so this is the left atrium. You can see here. So this is the left atrium wall. You can see here whole the part is only smooth. There is no rough. The rough is only present in that of a small ear-like extension, that is auricle. So you can clearly say whole of the left atrium is smooth. One more thing, the posterior part of the left atrium receives pulmonary veins. It has the four pulmonary veins are opening into the posterior wall of the left atrium. Yes, that is about that of the left atrium. So up till now we have done with the right atrium extensively. We have done with that of the left atrium. I think by now you can understand what is the demarcation between that chamber, that is the right chamber of the heart, and the left chamber of the heart. Now let's see the ventricles of the heart. I have done with the left ventricle, but features of both the ventricles, either it might be right or left, the feature is same. Why I have taken the left? because the thickness of the left ventricle will be more. It is about 3 times more than that of the right ventricle. But what the left ventricle has, same features, that is inflow tract, outflow tract, same are present. If you come across also, you will read the same things. So any ventricle, if you read it, the features are same. You can write the same thing. So let's do the ventricles, that is a left ventricle. What is it? When you see the left ventricle, so this is a right ventricle, ma. So this part here, this part which is forming the apex, this is a left ventricle. So when you take it, the left ventricle is more thicker. The reason for taking me also this chamber very precisely going in this chamber is only the reason is this one, that you need to understand that the musculature of the left ventricle, this is a left ventricle, the musculature of the left ventricle is 3 times more than that of the right ventricle. It is 3 times more thicker than the right ventricle, means the pumping action, because heart pumps the blood. So the left ventricle takes that, as the thickness is more, it takes more time. So musculature of the left ventricle is more, it is 3 times more than the right ventricle. Next, as all of you by now we knew it, the left ventricle is forming the external feature apex. The apex is formed by the left ventricle, and 1/3 of the sternocostal surface is formed by the left ventricle, and most of the left surface, that is 2/3 of the inferior surface. But when we say the external feature, the apex of the left is formed by left ventricle, and most of the sternocostal surface is formed by 2/3 of the sternocostal surface is formed by means of the left ventricle. The important point that you have to note here is left ventricle is 3 times more muscular, has 3 times more musculature than that of the right ventricle. This can be proven when you take the cut section. So when you take the heart, you have a cross section. So then you take a cross section. Here you can see this is a right ventricle, ma. It is like a slit. But when you see a left ventricle, it is circular, thick. You can see the thickness also. As such, we say it is 3 times more than that of your right ventricle. See how much thick it is, 3 times more than that of the right ventricle. So this is left ventricle. So when you take the cut section and see, I think by now you can understand how much thick is the left ventricle. The cross-sectional view, in the cross-sectional view, you can see the thickness of the left ventricle. It is more thicker than that of the right ventricle. Because of it, the circumference is round. You can see that one round circumference it is present. Yes. By these external features, let's go to the interior of the left ventricle. What is present to that of the interior of the left ventricle? Yes. When you see the interior, when you go inside and see the interior of the left ventricle, what it consists of? It consists of an inflow tract and a outflow tract is present. Means there is one which is called as an inflow tract, and one more, because the blood that is being received from the lungs is sending into the top of your left atrium, from left atrium to the left ventricle. That is the inflow part. There is an outflow part. The blood that has received from the left ventricle, it has to go, because it is a pure blood. It has to do the systemic circulation through ascending aorta, arch of aorta. That is that of the outflow tract. So this is the outflow tract, and this part will be that of the inflow tract. So when you see the left ventricle, its thickness is more, that is the first part. But when you cut open and see, you can come across 2 parts, that is the inflow and the outflow. As I have said, when you see the right ventricle also, you can come across, except that thickness, you can come across same features, that is the inflow part and the outflow part is present. Yes. When you see the inflow part, what are the things that you come across? The inflow tract includes left atrioventricular orifice. Between the atria and ventricle, there is an orifice which is called as left atrioventricular orifice is present, and in the left side there is a valve which is called as mitral valve or bicuspid valve which is present, which is forming along with other structures, means along with chordae tenere, commissures, clefts. It is forming a complex which is called as mitral valve complex. So the inflow tract includes atrioventricular orifice along with the complex which is called as, so this is the atrioventricular orifice. So when you see the inflow tract of the ventricle, whether it might be right or the left, what you can see when you see the left, because this is the left, you are seeing as a mitral valve complex, but on the right side it is consists of tricuspid complex, because on the right side, on the left side it is a mitral valve, but on the of your right side it is a tricuspid valve. So this is the left side. So what you come across is this is complex is called as mitral valve complex. So this complex what you come across is a mitral valve complex along with the orifice which is called as left atrioventricular orifice. So this orifice is called as atrioventricular orifice along with the complex which is called as mitral valve complex. Yes. As such, on the right, on the left side, there is a bicuspid valve which is forming a complex which is called as mitral valve complex or mitral valve apparatus. So what does this apparatus consist of? If you go on the deep and see as such for you, so it's not so important. Yeah, your book I have only named and it has not gone into deep. But let's see, if you are saying in the class, let's see what is present there. Yes, what is this apparatus includes? The apparatus includes the mitral annulus. So this is part is called as the mitral annulus. So this is annulus surrounding the valve. So this is called as mitral valve annulus. Which annulus consists of? The anterior annulus is present, posterior annulus is present, and these are the leaflets, because on the left side it is a bicuspid, on the right side it is a tricuspid. So the mitral valve leaflets, that is the two anterior leaflet, this is the anterior leaflet, and these leaflets are called as that of the posterior leaflets. So this is anterior leaflet, this is a posterior leaflets. The anterior and posterior annulus are joined by means of commissures. So these are called as the commissures which are present. From there, what are extending like a strings? You can see something extending like a strings and attaching to a conical projected muscles which are present. These are called as a papillary muscles, and these strings which are extending from the leaflet are called as chordae tendineae. So these are called as chordae tendineae. These are the strings which are attaching to the conical projections muscles which are called as papillary muscles. This is anterior papillary muscles, and the thick muscle what you are seeing is called as posterior papillary muscle. And you can see the valve here, that is a left ventricle valve which is very thick, forming a network which is called as trabeculae carneae. So this is formed by trabeculae carneae. In the next slides you can see very clearly what is that one. So the network that you are seeing, so this is called as that of your trabeculae carneae. Let's go in deep. So you can see here, yes, so this structure as a mitral valve complex, this is a mitral annulus that you are seeing. So that part surrounding it is called as that of the mitral annulus. So this is the thing that you are seeing, this is a mitral annulus which consists of anterior leaflet, this is the anterior leaflet, and this thing what you are seeing is the posterior leaflet. In the mid part what you can come across is the commissures. From there what you are extending downwards as a thread like structures. Yes, these are called as chordae tendineae, which are extending and attaching to the top of the muscular projections which are called as a papillary muscles. So these are papillary muscles. So these anchor for the leaflet. So when you are seeing it, these are the chordae tendineae which are present. These are the chordae tendineae which are present. There are also many types of chordae tendineae. Yes. More. So this part what you are seeing is left fibrous trigone, and this is the right fibrous trigone or the aortic valve which is present. So as such, so this is the left atrioventricular orifice guarded by means of a bicuspid valve, consists of mitral valve complex. This is a right atrioventricular orifice which is present, guarded by a valve which is called as a tricuspid valve. So this valve is called as tricuspid. This consists of three cusps. It is consists of two cusps. both is forming, it is a right fibrous trigone. So this is forming a trigone, which is called as, on the right side is called right and the left side is called a left fibrous trigone. This is the trigones which are forming at. Yes, ma. Same thing you can see here very clearly. You can see the trigone, you can see the annulus, you can see the leaflets. So this is the of your fibrous trigone. You can see the left fibrous trigone, right fibrous trigone, left anterior annulus is present, posterior annulus. There are some commissures which are present. So these are the commissures. From there, what it is extending, the thread-like structures. These are called as chordae tendineae, which are attaching to the conical projections, which are called as the papillary muscles, forming as a complex, mitral complex. Same way, this we are seeing on the left side. Remember, if we go and see on the right side also same thing, but unlike the mitral annulus, what you will be getting to see, there is tricuspid annulus you will be getting to see. Yes. In the mitral annulus, you come across the leaflet. So these are called as mitral valve leaflet, that is anterior leaflet, posterior leaflet. Let's see the leaflets. What does this leaflets consist of? So after the annulus that you have seen, which includes anterior and posterior part. Now this leaflet, what does leaflet includes? There are, because this is a bicuspid valve, it consists of anterior and posterior. If it is tricuspid, anterior, posterior and septal will be present. So there is anterior leaflet, posterior leaflet and septal leaflet if it is tricuspid. But as such, we are going to the bicuspid valve. See the leaflet what it is present. So when you open the leaflet and see only the leaflet, what does that leaflet consist of? You can see the leaflet, that is the anterior leaflet. So yes, this leaflet, anterior leaflet, it consists of a clear zone and a rough zone is present. A rough zone to which chordae tendineae will be present. But normally what is present in the leaflet is normal basal zone, clear zone and rough zone. The anterior leaflet, what it includes it includes the clear zone and includes that of the rough zone. Clear zone there is no attachment, but in the rough zone you can see the attachment of the chordae tendineae which are present. So this includes anterior zone, includes clear zone and the rough zone. Same way, when you see the posterior leaflet, so earlier you have seen the anterior leaflet which has only two zones, clear zone and the rough zone. But when you go to the posterior leaflet, so this is a posterior leaflet where there is three zones. There is basal zone, clear zone, rough zone. If you come across the anterior leaflet here, you can see only clear zone and the rough zone. There is no basal zone and the anterior leaflet. But unlike in the posterior leaflet, you can see the three zones, that is basal zone, clear zone and that of the rough zone. So these are the features of the leaflets. It might be 3 or it might be 2, anterior or posterior or septal, but these are the things that you can come across in the leaflets. That is 3 zones, rough, clear and basal. Yes, ma. So this is the leaflets. So you came across the 3 zones from which you can come across the chordae tendineae which are attaching to the papillary muscles. Yes. So I think this is a clear picture showing the 3 zones, basal zone, clear zone, rough zone. Yes. From the leaflet, what are extending means up till this part we have done mark.